Good evening, dear listeners, and welcome to the fourth episode of our special series on the nationwide drive to eliminate tuberculosis. In today's episode, we are focusing on a critical aspect of the effort, mapping vulnerable populations during the 100-day TB Elimination Campaign. As we know, certain groups, especially those in marginalized communities, are at a higher risk of contracting and spreading TB. To effectively combat this disease, it is essential to identify and engage these at-risk populations. This targeted approach not only helps reduce the spread of TB, but also ensures that resources and care reach the people who need them most. Stay tuned as we explore this important aspect of the campaign. Joining us again today is Dr. Vezokholu Theyo, State Program Officer of National TB Elimination Program, Directorate of Health and Family Welfare, Government of Nagaland, who will walk us through this crucial subject of identifying these populations and the targeted approaches being taken to making real progress in achieving the goal. I am Mary, your host for the program. Thank you, Madam. It's good to have you again in our studio. To begin with, could you explain why identifying and treating missing TB cases is so important during the 100-day TB Elimination Campaign?
Missing TB cases are an important measurement for disease control as undiagnosed, untreated TB cases may spread the infection in the community. Missing a presumptive TB patient is a missed opportunity to eliminate TB for following reasons. These TB patients, if not diagnosed, will continue to spread the infection. Each active TB case can infect 10 to 15 people during a year if left untreated. If left untreated, it is likely that more than half of them die by 3 years. TB is curable, but early diagnosis and treatment initiation is essential prerequisite. There can be symptomatic cases in the community which should be identified utilizing various case-finding approaches like active TB case-finding campaign, mobile camps, population-based screening, apart from screening in HIV and non-communicable disease setting. A proper identification of presumptive TB patients is therefore important and should be encouraged to refer to TB detection centers for early diagnosis and treatment to prevent further spread of the infection.
So talking about missing cases, Madam, can you share how many missing cases are still yet to be identified?
In 2024, notified cases were 3,947 of the targeted 5,000. Mm-hmm. So we have missing of 1,053 cases. So this campaign is the high burden district of Kohima, Mon and Wokha. So as per the target for Kohima, we have 188 missing cases, mm-hmm. Mon 121 and Wokha 46. So these are the missing cases, and with the launch of this 100 TB campaign in this district, Kohima has notified 40 TB cases on treatment now, Mon 36 and Wokha 10 out of the 46 missing cases has been identified and put on treatment.
So which groups are considered high risk for TB, and why is the department focused on these particular populations in your campaign efforts?
So these vulnerable populations are the elderly people more than 60 years, undernourished, people with comorbidities, people living in congregate and closed settings, smokers, alcoholics, contacts of TB patients, past TB patients are considered high-risk groups and are focused during the campaign. These populations are considered at risk to TB because they often have a weakened immune system due to factors like malnutrition, HIV infections, diabetes, substance abuse, or living in conditions with poor sanitation and overcrowding, making them less able to fight off the TB bacteria once exposed to it, and this greatly increases their risk of developing the disease. Socioeconomic factors like poverty, lack of access to healthcare, and displacement can further increase their vulnerability to TB. People in congregate settings like prisons, orphanage, old age homes, or residential schools are particularly vulnerable because of the increased exposure associated with their living conditions.
Okay, so in addition to this, in the context of TB elimination, what is meant by vulnerable populations, and why are they being specifically targeted in this campaign? Also, how are they being reached during this campaign?
In the context of TB, vulnerable population and key populations are used synonymously. It refers to the list of individuals, as mentioned earlier, who are at an increased risk of contracting TB and includes elderly people, more than 60 years, low body mass index, less than 18.5, diabetics, HIV patients, immunocompromised patients, on immunosuppressive drugs, etc. The strategies to reach them include mapping of the vulnerable population till the last mile service delivery points, that is, our health and wellness centers, creating awareness and IC activities conducted at community and village levels to mobilize the vulnerable population in attending the health camps, and conducting health camps, the Ni-Kshay Shivir, the campaign which we are on now, using our mobile medical units, that is the Ni-Kshay Vahan, fitted with ultra-portable digital handheld X-ray and AI solutions and NAT machines.
So, Madam, could you describe the process of identifying and mapping these vulnerable populations in the targeted districts of Kohima, Wokha, and Mon?
Yes, the process of identification and mapping of this vulnerable population undergoes several steps. One is, we started off with the micro-planning step or the line listing of all the earlier mentioned vulnerable populations, and these are carried out by the ASHAs for the villages designated for them. Then the line-listed vulnerable populations are then consolidated by the community health officers, that is, our nurses who are there at the health and wellness centers, sub-centers, or PCs, which are finally compiled at the district level. The mapped vulnerable population are the screened with X-ray and NAT, that is molecular testing, of the collected sputum samples during the Ni-Kshay camps. Sputum samples are collected for the abnormal X-ray detected and also the symptomatic cases in the vulnerable population. Also, the symptomatic of the general population we are taking. Additionally, at special clinics like HIV, NCT, there will be 100% of the vulnerable population and 10% patients of OPDs in other departments, that is in the health setup, they will be screened.
That is quite informative. So you have mentioned that for Nagaland, Kohima, Wokha, and Mon has been chosen as the key districts for this campaign. Can you describe why these particular districts have been identified as the key targeted districts for this intensified TB elimination effort? Also, what makes these areas particularly critical in the fight against TB?
The progress made so far and to address the challenges in achieving our sustainable development goal, there is a need for a renewed approach. The TB burden in India as well as in Nagaland has wide variation in TB burden across different geographies. Also, the progress made on key performance indicators, we call it KPIs, by the state, UTs also had wide variations. Low presumptive testing rate, increased mortality, that is increased death due to TB, and increased incidence rate in the three selected districts of Kohima, Mon, and Wokha are the primary reasons for choosing the districts. Hence, to accelerate efforts in finding missing cases, reducing TB deaths, and prevention of new cases, a stratified approach has been designed to be implemented through this campaign. While routine programmatic activities will continue in all the other districts, the campaign-specific focus interventions will be put in place in these three selected high-focus districts for increased case detection, increased coverage of nutrition intervention, and increased awareness in the community towards importance of early case detection and complete treatment of TB.
Okay, so how do geographic, social, and economic factors affect the spread of TB in these particular districts of Nagaland?
Geographic factors like climate and population density, then social factors like poverty and access to healthcare, and economic factors like living conditions and malnutrition all significantly impact the spread of TB, making certain areas more vulnerable to infection and transmission. For example, poor ventilation and overcrowding in homes, workplaces, and communities increase the likelihood of uninfected individuals being exposed to TB infection. Poverty, malnutrition, and hunger may increase susceptibility to infection, disease, and severity of clinical outcome. However, particularly in the 3 selected districts, the burden was in terms of TB-related mortality, which may be attributed to comorbidities like HIV, diabetes, and increase in the incidence rate that may be due to lack of access to TB screening, testing, and nutrition. So here, nutrition is an important factor in tuberculosis treatment and prevention because there is a two-way relationship. Undernutrition increases the risk of TB, and in turn, TB can lead to malnutrition. So these are the factors affecting the spread of TB in this particular district of Nagaland.
Coming to the strategies for reaching out to the key populations, Madam, what kind of outreach methods, say for example, door-to-door campaigns, health camps, awareness sessions, and so on, are being employed in these districts?
So we have these campaign-specific branded mobile medical units, Ni-Kshay Vahans. These are used for the health camps, door-to-door visits, and awareness sessions for the 100-day TB campaign. About one mobile medical unit, each are fitted with NAT machines, that is for molecular testing, and handheld digital X-ray, and additional Vahans available under NHM, NACO, NGOs like Hans Foundation we have in Mon district are utilized for IC activities, organizing camps, and mobility of health personnel. The MMUs would have trained lab technicians and radiographers and supporting staff. These vans will conduct on-spot chest X-ray, the TrueNet machines or CBNet machines for sputum testing, and any other tests as per local context wherever required. So in addition to these mobile medical units provided, the other following services will be to provide education on TB symptoms, prevention and treatment, and refer or transport confirmed cases to healthcare facilities.
And is there any role that technology play given the fast-moving pace of technology in today's world? What role does technology play in mapping and tracking TB cases and vulnerable populations?
Yes, technology plays a crucial role in providing an enabling ecosystem which provides a very conducive environment and a strong foundation to implement advanced solutions and ensure adequate uptake of services. Here in India, we use Ni-Kshay digital platform as the national case-based TB notification and surveillance. Over the years, this platform has evolved and has become a real-time case-based TB information management tool. To name some of the technologies which are being used in this National TB Elimination Program, we have Ni-Kshay available as web and mobile application. Then we have this Ni-Kshay Aushadhi for logistic and drug management, supply chain management. Handheld ultra-portable X-ray machine, a mobile screening tool with AI result interpretation capability is available. Then we have this TB Arogya Sati app-based community-led monitoring tool. Then we have this CUF app against TB. So this is AI-powered TB screening tool using cough sounds. Then we have this NAT, a newer molecular rapid diagnostic test that detects TB and drug resistance, and adherence technologies like 99 dots.
So you have mentioned the different types of methods to reach out to the population, be it traditional methods or through technology. So what kind of data is being collected during the mapping process, and how is it being used to guide future TB elimination efforts?
The campaign's success relies on meticulous operational planning and resource mobilization at every level. Information parameters collected during the mapping process include the following. We have the micropenning data. This will include the detailed line listing of the vulnerable population, which I have mentioned earlier, 60 plus, elderly group, undernourished, people with comorbidities, people living in congregate and closed settings, smokers, alcoholics, contacts of TB patients, past TB patients, including symptomatic of general population. So will be the microplanning data. Then the human resources will be the number of healthcare workers, the ASHAs, the ANMs, the CHOs, the lab technicians, senior treatment supervisors, TB supervisors, medical officers. Then logistic and infrastructure will be number of screening and testing capacities like the mobile handheld X-ray and NAT testing, and supplies and consumables including the specimen collection containers, sputum transportation tools, and testing kits. Then the Ni-Kshay facility login credentials for reporting and campaign activities. So this is where how the data is being collected during the mapping process.
So, ma'am, given all the campaign activities and outreach programs that the department has been putting effort into, can you share any early results or stories of success from the campaign so far in Kohima, Wokha, and Mon?
So far, under the 100-day campaign in this 3 districts of Kohima, Wokha, and Mon, the summary of the late activities up to date are: map population is 10,288, vulnerable population map. The Ni-Kshay Shivir, the campaign conducted is 104. The vulnerable population screen is 2,687. Screening with our X-ray is 1,876. NET testing is 794. Diagnosed with TB in our outreach activity is 11. Ni-Kshay Mitra registered is 34, and food basket distributed is 123 to these TB patients. So like our outreach activity, we are trying to identify people who are not coming to us because as per our SDG goal, leaving no one behind suffering from TB, we have to reach the unreached, and together we can get closer to TB-free status.
Those are very insightful figures that you have shared, ma'am. Thank you so much, Dr. Vezokholu Theyo, for the highly informative discourse on the importance of mapping the vulnerable populations for effective implementation of the TB Elimination Campaign. Thank you, madam. Well, listeners, that was a very insightful discussion, and we hope this conversation has shed light on the critical importance of identifying and reaching vulnerable populations in the fight against tuberculosis. As we have discussed, targeted efforts like the 100-day TB Elimination Campaign are key to making meaningful progress. For the campaign to attain its ultimate goal, community participation is vital to complement the efforts of the authorities. Everyone needs to get involved, whether by raising awareness, supporting local health initiatives, or helping to identify, reach those in need. Together, we can truly make a difference. Until next time, take care and stay engaged in the fight against TB.